there, welcome to the clinic. My name is Bibi, and I'm going to be performing a cranial nerve examination on you today. So cranial nerve examination is basically me testing the nerves in your brain and how they function with the nerves in your face, like your eyesight, or your sense of smell, or your sense of hearing, or anything like that. So your doctor, I'm assuming she sent you here because she gave me a phone call and she told me that you had a concussion a while back, and now I'm here to make sure that this concussion hasn't affected you in any way. Okay, before we start, do you need water or anything? Nope. Okay, well, if you change your mind, I have a water bottle or a glass of ice water with your name on it. Okay. So I'm going to ask you a few basic questions first, just to fill out a form on my computer. Okay. First question, what's your name? Okay, what's your last name? Can you spell it for me? Okay. Where do you live? So what's your address? Okay. And is it road? Yeah. That's actually a really nice neighborhood. And your phone number, last thing? And would you rather it be cell phone number or home phone? Cell phone? Okay. Perfect. Before I get started, I'm just going to explain to you what we're doing. So I'm testing the nerves in your face, like I said. So I'll start with your eyes, and I'll move down to your nose, and the muscles in your mouth, and your face, and then your hearing in your ears, and even if we have time, I'll test the neck, or the muscles in your neck, and the flexibility of the neck muscles. Okay? So I'm going to ask you a few questions just to fill out this form. Do you wear any contacts, like contact lenses or glasses? Have you ever in the past? Okay. Oh yeah, and I'm just going to bug you about this, but you make sure to see an eye doctor annually, right? Once a year? Okay, great. Just checking. No contacts or glasses. Okay, have you been having any problems that I should be aware of with your face in relation to your neck, your face, even your thought process? Okay. Do you get any headaches? I get headaches too like that. It's usually stress related or I've slept funny. And what I do is just take Tylenol, go to sleep early, but I'm talking more like chronic headaches, so headaches that you'll get every night or every day or something. Nope? Okay. And any neck aches? That could be because you're sleeping funny, but it doesn't seem to have an effect on you. So I just recommend taking Advil if it bugs you for the morning. Okay, I'll just type this down really fast. Okay, now we're going to start the fun part. So I want you to focus on a point on my face. So it can be in my eyebrows, in between my eyebrows, or on the tip of my nose, or on top of my lips, or any place here. Do you have it? Okay, now I'm going to hold out 2 fingers. I'm going to wiggle one of them. Okay? And I want you to point to which one's wiggling. Okay. Yeah, both of them. Okay, perfect. Now I want want you to cover this eye. That's your left eye. Yeah. And do the exact same thing. Focus on a point on my face. Perfect. Other eye. Yeah. Keep focusing, because I know you can be tempted to look at my fingers, but just stay right here. Perfect. Okay, you got everything completely right. Usually some people get one or two wrong, but you are perfect. So obviously nothing's wrong there. Now I'm going to study your peripheral vision. So that's basically your field of view. So I'm going to hold my hand. So we're going to do what we did before. Focus on a point on my nose. Right here anywhere. And hold two fingers out. I'm going to push them apart. And when you can't see the fingers anymore, and you can't see both of them, I want you to say stop. Okay? Okay. Yeah. Keep focusing on my face. Stop. Perfect. And this one again. Okay, this time I'm going to wiggle my fingers like this. And so look at my face. Yeah. Perfect. That was honestly 100% right. So let's just write that down. Now I'll do a quick one. So I want you to take a look at my pen. I'm going to move a bit closer if that's okay, okay? Look at my pen. So I want you, it's a nice pen. I want you to focus on the point on it. So focus on this top point. Right here. And I want you to follow it with your eyes, okay? Here we go. Now cover this eye. Left eye again. Yeah. Next eye. Okay, really slow. Okay, perfect. That was great. It's always kind of funny looking at someone because you can see their eyes moving. I'm going to come up really close, if that's okay. And I'm going to be using this light. Okay, you see it? So what I'm going to be doing is I'm going to be looking at your pupil way up close. And it's not going to hurt you, I pinky promise. This light is just, it's harmless. I don't recommend doing it every single day, but right now, it's not going to hurt you in any way. So I'm going to cover this eye for myself. I'm going to look here. Okay, your pupils seem to be dilating fine on that eye. Some people might have a lazy eye, so it might not work. pupils dilate fine. Yep, there's no delay. Now I'm gonna look at this eye again, and I want you to look up. Okay, down. Look left. And now right. Okay, up to the right, and down to the right. Up to the left, and now down to the right. Okay, perfect. I'm going to do the same to this eye. Up, down, to the left, to the right, up, right, down, right, up, left, down, left. Perfect. I'm just going to give you a moment to get your eyesight controlled. Yep. Okay. Are your eyes okay? Do you feel blurry or anything? No? Sometimes a few patients can feel a bit blurry after this. Can see their eyesight's a bit blurry. But you seem to be fine. And I want you, just really quick. This won't take a lot of time. It's just to follow the light with your eyes. Stare at the light. Okay. Yeah, perfect. You are fantastic. Okay, so that's all we need to do with your eyes. So like I said, now we're going to be moving from your eyes to your nose and your sense of smell. So I want you to close your eyes so you can't see what I'm doing. And I'm going to have 3 things for you to smell. Okay? And why this is important actually is to make sure that if you smell something, you can recognize if it's bad. So you can smell moldy food and it saves you from eating it. And you can smell poison, so you know not to drink some type of acid in case that ever happens. So yeah, okay, this first one's in a spray bottle. So I want you to close your eyes. Yeah, keep them closed. I'm going to spray it, and then I'll tell you to smell, okay? Smell? Okay, what does that smell like to you? Yeah, it's vanilla. It's one of my favorite scents too. Next is in a glass. So you can close your eyes. I never said to open them. Close them. And this is a strong smell, so I'm going to waft it to you. And I want you to tell me what it is, okay? Okay, smell? Yeah, it does smell like smoke. It's actually an ember from a fire. So yeah, it's just to test if you can recognize a dangerous smell. Okay, last but not least, I have a paper bag. So keep your eyes closed. And here's the paper bag. And it has a smell in it. So just smell it. Okay, smell. Yeah, that one's easy. It's cinnamon. Yep. So these were all fairly easy, and you got them all right. So that's perfect. Okay, here's the fun part. I'm gonna get you to make a bunch of funny faces for me. First, I want you to smile. Like a really closed lip smile. I'm gonna feel your face. Okay. Now do a big open mouth smile like this. Yeah. just making sure your cheekbones are nice and tight. Now grit your teeth. Make sure all your teeth are showing. Yep. Clenching your jaw. Okay. Let's see. Okay, now a few cheek exercises once again. I want you to puff out your cheeks like a blowfish. Do that. Just making, That's to check to see if there aren't any bumps. Now do a kiss face. Now do the same face, but I want you to suck in like a fish. Yep. Okay. Perfect. Now let me just put your lips in together like this. Yeah. And crinkle, lift your eyebrows up really high. I'll show you with mine. Really, really high. Yep, and crinkle your forehead. Crinkle it. Okay. Yep, perfect. Now, a few more faces. I know, we're almost done. I want you to stick your tongue out, all the way. Tongue up. Lift your tongue up. Okay, lift it down. Can you do this? It's a fun trick. Okay, now I want you to stick your tongue all the way up. I'm gonna look inside. Do it. I'm just looking inside your mouth. Say ah. Ah. Yeah, I'm just checking your tonsils. Did you have them removed? Yeah, when you were younger? Yeah, I guess your parents didn't like snoring. Oh, also, can you touch your tongue to your nose? No, I can't either. I have a friend who can. It's really fun to watch. Now I've got a nice clean Q-tip here. I'm going to test areas of your face. I'm going to touch them lightly. And I want you to tell me if you can feel it or not. So here you go, ready? Yep. Just tell me if you can. Okay, now I want you to close your eyes. And I'm going to touch your eyelids. And I'm going to make sure that you don't have any crinkling or anything. Don't worry if you're wearing eye makeup, I promise I won't smudge. So close your eyes. You're fairly young, so you don't have any signs of wrinkling or anything in your eyelids, which is very, very lucky. Yep. Okay. Now we're going to move on to another step. I'm just really quickly going to do your hearing. So there's a few exercises we can do. There's one where I snap my fingers, but I find that can be very loud. So instead, I'm going to whisper a few words in each ear, and I want you to repeat them to me. Okay? Okay. Apple. Cataclysm. Orange. Vibration. Okay, can you repeat the words back to me? Perfect. Now the next. Do you rather? Satchel. Test. Rocket. Strawberry. Did you hear them all? Okay. Can you repeat them back? Okay, perfect. Yeah, you did it surprisingly well. Not a lot of people get the hearing one. Okay, now again, I'm going to whisper a few more words in your ear. Okay. Harmony. Peace. Teddy bear. Recorder. Yep, and you'll notice they all have different vowels. Yep, you got them all right. Okay. Now I'll say some in your other ear. Rainbow. Dresser. Kite. Sunshine. Okay, repeat the words back. Yep, rainbow. Yep, that was it. Okay. Okay, so it seems like we have a bit of time. So I'm going to test the muscles in your neck now, okay? Now I want you to do a few neck exercises with me. And if you feel any pain or discomfort, I just want you to tell me right away. Okay? Let me see. First we're going to rotate your head in a circle. And I want you to bring your head and your chin all the way down. Okay. Chin all the way down. You're going to move your head to the left and to the right. And now look up and do the same. Left, right. Sometimes my neck cracks when I do that, so you have to be careful. Now with your shoulders, I want you to lift your shoulders up. Yep. Now down. Now your left shoulder up. Yep, well I'm doing my right, but yeah. And your right shoulder up. Down. Now roll them backwards. And forwards. And up again. And down again. I'll just write this in really quickly. Okay, now what I'm going to do is I'm going to come up really close and I'm going to feel the glands in your neck, this part, to make sure that they aren't swollen or anything. So I'll just okay, and I'll move here. Yep, it's a good thing to do when you're sick, to make sure that they aren't swollen to a point where you need to see a doctor. Okay, your glands are fine. Yep, so I'm just going to write this all down one last time. So judging by all the tests that I did, you seem to be completely fine. Yeah, there's nothing wrong with you. In fact, you're one of the better patients. Okay, so goodbye, and I hope I see you again sometime.